Good morning, everybody. Thank you for joining us today. Our breakout session is bridging the divide with the use of VA video connecting peripherals. And we have our presenters are going to be Rivish, Leslyann, Roose, and Jeremy Chapman.
We can begin?
Yes, sir.
All right, thank you so much. Thank you everyone for the opportunity to present to you today. We're very excited to talk to you about what the VA is doing with regards to bridging the digital divide, okay? My name is Val Rivish. I'm a telehealth training specialist at the VA Central Office, Office of Connected Care is what we call it. Along with me is Jeremy Chapman. He's a telehealth research technician with Ironbow Technologies. He's going to be helping me on my portion and our portion of the presentation. And to follow will be Leslie Roose, who's the national lead of the Atlas program. We have a few PowerPoint slides that we're going to go through. This is what our agenda looks like, and then we'll go into a live demonstration. We're going to talk a little bit about what the digital divide is and how that impacts care. We're going to talk about some of the VA mobile apps that are available for veterans. We're going to look at a few actual live veteran testimonials that they've made with regards to the use of this program. And we're going to do a live demonstration. And then we're going to go to Leslie for another innovative way of bridging that gap. It's called Atlas, accessing telehealth through local area stations. So first, what's digital divide? Digital divide is that gulf that exists between those who have ready access to computers and internet and those who don't. Yes, even in 2021, there are people who don't have internet and don't have all of the technology needed to do telehealth. We found that approximately 30% of the veterans that the VA serves lives in rural or highly rural areas. And connectivity in the home is crucial for many things: healthcare, job functions, school, etc. So digital skills are needed, and the ability to connect so that you can have meaningful use of these things in life. I'm going to let Jeremy talk next here.
Awesome, thanks, Val. So the VA has a suite of virtual tools to essentially complement care that is being delivered to veterans, whether it's your traditional face-to-face or virtually. Many of these mobile apps can be used by veterans on their own accord to manage different diagnoses such as depression or hypertension. And some of the apps are used in tandem with reoccurring video visits or your traditional face-to-face visits. And so the VA, just to kind of name a few of the mobile apps that VA has, there's probably about 40 different apps, but just to name a few, they have the Insomnia Coach, which provides guided training and tips to help the veteran track insomnia and improve sleeping habits. There's the Mindfulness Coach, which will teach veterans to learn different types of skills on reducing stress and improving emotional balance. The PTSD Coach, which provides educational and informational tips, and the veteran can actually go in and do a self-assessment for those that are affected with PTSD. There's also the VA Fit Heart, which is part of the cardiac rehab program. This app guides veterans through education and fitness training over a 12-week period. And like I had said, that was just to kind of name a few. There's a slew of VA mobile apps that are available. And we'll hand it back over to you, Val.
Yeah, so here what we're looking at now is some of the equipment, we refer to them as peripherals, that we can send to patients for use during live video telehealth. These include an iPad, they include thermometers, scales, oxygen saturation probe monitors, blood pressure cuff and machines, and what we call the Echo Duo stethoscope. There is also no copay for veterans when doing video sessions from within the home with the healthcare team. So that reduces barriers to veterans as well from a financial aspect. And obviously, some of our veterans living far from the VA or far from our outlying clinics doing care through these types of technologies also reduces travel burdens and costs from travel and time having to be taken off of work and whatnot, finding babysitters, et cetera, to try to stay in touch with the healthcare team. We will demonstrate the use of these later in our presentation. Taking a look at a few actual testimonials before we do the live demo, it's important to see what some of the veterans are saying about having used some of these devices and some of these peripherals with their healthcare team. One veteran says, "I would prefer video because it would expose me less to sick people." Naturally, with COVID, this has become very important. Another veteran says, "I get to see the provider just as if I were to have come in person to the VA, and it's just as good." Another veteran says, "Sometimes doctors need to examine patients. I think it's wonderful for therapy because all I need to do is talk." And another veteran says, "Need to give a class on how to use the tablet and make sure the connection and passwords are done right." So we'll talk a little bit about that as well, because that is important. And because of that last comment, we have instituted what we call our white glove service program, or the connected device support program. It's a group of subject matter experts that will contact each veteran after they receive a VA loaned device. So after the VA sends the devices out to the veteran, a few days later, they will be contacted by our white glove service subject matter experts, and they will offer any assistance needed to set up the device, to do practice calls, and feel comfortable before they actually have to connect with their provider for the real visit. They will help them set up some of the peripheral devices, like if they've received a scale or if they've received a cuff. They practice and get all that set up for them. If they need help creating a new email on that VA loan device, that's also part of the all-inclusive white glove services that are provided to our veterans. So this has really made an impact on being able to successfully use the devices that we have available for our veterans. These telehealth subject matter experts even include Spanish speaking, so we're able to assist the Spanish speaking veterans as well, being that we're in Arizona, that is a need. So these especially trained technicians are able to help with all of the above items. So now what we'd like to do is we'd like to go into a live demonstration. Before I do, I'm going to set the stage here. I am a clinician at the VA that is going to connect with my veteran, Jeremy. My veteran has received an iPad from the VA. My veteran has received the full complement of peripherals that are available. And now we're going to go to a live session. I'm going to stop my video on the Zoom call so that I can properly use the video on the VA Video Connect side of the house. So give me a second there to do that. Give me just 1 second. And while I log in, I'm just going to say a few more words. It doesn't cost the veteran anything to receive these devices. They're free. They're loaned. Loaned means that they do get to keep them for the duration of the time that it's needed for their care. Sometimes that's a few weeks. Sometimes that's a few months, depending on the type of care that they are enrolled in with the VA. So here I am now entering what we call a VMR, a virtual medical room. And in the upper right-hand corner, I see myself as the provider, as the VA clinician. And in the middle of the screen is my patient, Jeremy, who's at his home. So we're going to demonstrate the use of some of these peripherals. Jeremy, I see that you have already turned on your oxygen saturation probe. If you'd like to kind of put it on your finger and show the audience what that looks like. Also,
yep, definitely. And so this is the O2 saturation probe. These devices are Bluetooth enabled, so essentially they'll automatically connect to the VA issued iPad.
And while you have your thermometer handy, go ahead and show the thermometer that you have. And I see that you've already taken a temperature, so that's good.
And we also have the 4 thermometer, which is also Bluetooth enabled. So it's the simple ear thermometer.
All right. And he also has a scale that we've issued to him. So if you want to just hold up the scale so that they can see what that looks like. And then after you do that, if you don't mind hopping on the scale, and that way I can see what your weight is and I can compare what your weight is today with what your trend has been throughout the week.
Yep.
And if you notice while he does that, all of these devices are wireless. They connect to the VA issued iPad through Bluetooth technology. So there's no complicated cords. It's very straightforward. When a veteran receives these devices in the mail, they come with pairing guides, we call them. Very colorful, easy to follow instructions on how to pair the devices to the iPad. And again, the white glove service covers this with the veterans that have received these devices. So now, Jeremy, I want to monitor your blood pressure real quick. So go ahead and I see that you've put your cuff on. I'm reading in your chart that we've made some recent blood pressure medication changes. So let's go ahead and show the audience the blood pressure cuff and let's get a quick reading.
Yeah, definitely. So we have the blood pressure monitor, and then we have the cuff that's attached to my arm. And it's fairly simple. We'll just hold down the start button on the blood pressure machine. It'll ask me to pair the device. And now we can see that down on the bottom right, the blood pressure is popped up, and then we just have to hit start, and that will take a blood pressure reading.
So while that cycles, I'm just going to talk to the audience for a minute. The beauty of what we're able to do here is that, so now I'm on one side of Arizona actually, and Jeremy's in a different state, yet we're able to conduct live synchronous care in this way. No longer is it a phone call and I'm wondering what the patient's looking like or feeling like. I'm actually connected with the veteran. We get to see each other, we get to hear each other, we get to see each other and talk, and more than that, I'm actually getting vital signs. And not only am I getting the vital signs, I'm also monitoring to see if he's doing it right. So for example, if the veteran has labile blood pressures, one time it's up, one time it's down, doing a quick session like this can confirm that, yep, he has the right size cuff and he's applying it appropriately, right? Sometimes that happens, you know, if a veteran doesn't have the right size cuff and he's putting it, you know, down here versus up here, through a session like this, lots of issues can be solved. So as that blood pressure cycles, in just a second, I will be able to see that. And I see his blood pressure's there and his diastolic is a little elevated. So I'll have to adjust his meds a little bit. Jeremy, why don't we go ahead and show how we can make that grid of vitals disappear in case it's in my way and in case I can't see. There's a down arrow there on your end. Go ahead and hit that down arrow and let's show the audience what happens with that grid. It completely disappears. That way I can utilize the full screen. And if I want them to come back up so I can document these into the electronic health record, he can hit the up arrow on his iPad and the grid reappears. Nice little feature there. The next thing we'd like to show, and it's by far one of my favorite features, and really this is a game changer in the way we do virtual healthcare. With a device that looks like this, smaller than your typical cell phone size, I can do some pretty powerful things, and we'll demonstrate this in just a second. With this device, which is called the Echo Duo stethoscope, I can do two things, and that's why it's called Echo Duo. It's got two functions. One function is that it's a one lead EKG reading. So it'll again wirelessly connect through Bluetooth. When the veteran applies it to his skin, and we'll demonstrate this in just a second, I will be able to live stream and see a one lead EKG of Jeremy's heart rhythm. And the second function that this does is it also is a digital stethoscope. So I can auscultate his heart sounds, his breath sounds, and his bowel sounds. Jeremy, why don't you go ahead and pull your device and talk for a second about how you turn it on, and then we'll demonstrate this piece next.
Yep. So here's the Echo Duo device, and there is a little button right here, which I've already pressed. And once it's turned on, there will be a light up here. And then on my iPad, a little stethoscope icon will pop up. And so essentially what I need to do is press that icon, which will send a link to Dr. Val or Dr. Rivish as my provider. And with that link, he will be able to access the live stream of the ECG.
So if you notice, when he clicked that, a little small indicator on the left of my screen popped up, a little circled red number 1. That means there's a new event that I need to look at. So I'm going to open up that side panel, and in my events tab of the virtual medical room, I do see that there is a new event. That event is the link that his Echo Duo device sent to me. So I'm going to go ahead and click that. By me clicking that on the provider side, it's going to open up another browser to what we call the Echo live stream page. So right now, it's going to start receiving information from the veteran's device. What I can do with this screen is I can pick it up and move it. I can move it to my other monitor. The VA providers who do this type of care have two monitors for this type of reason. On one monitor, we can visualize the patient and have that conversation. And then in our other monitor, we can look at other things like the electronic health record, like the Echo telehealth live stream page and other things. So I'm going to leave it on this screen so that you can see what I'm looking at here. So right now, the veteran has the Echo Duo device placed onto his skin, and I am seeing a 1-lead EKG. I have some options here right now. It's in the diaphragm mode. So I can change that from my end to Bell. So I can listen to Bell mode now. I can change it to mid-range or to extended range, depending on if I'm trying to listen for a murmur, if I'm trying to listen to S1, S2, lub-dub type of sounds or whatever. At the bottom is just a visual waveform of what I'm hearing. In my headset, I am hearing his heart sounds right now pretty clearly, and I am seeing a fairly clear 1-lead EKG. How powerful is this, right? My veteran's at home, relaxing in his couch, and I'm able to do this type of care. It's pretty amazing. All right, I'm going to pull that back out of view here. So that's how the VA is bridging the digital divide between veterans who don't have technology and don't have internet. By the way, I failed to mention earlier that the device, the iPad that we send has built-in 4G LTE internet. So if the veteran doesn't have internet, if they don't have devices or emails or none of that technology, that's not necessarily a barrier anymore to doing telehealth. And we're happy to be able to demonstrate this. What I'd like to do next is I'm going to turn over to our colleague, Leslyann Roose. She's the national lead of the Atlas program, and she'll talk a little bit about the Atlas program and how that also is being used to provide care to veterans out there in the community. Leslyann, turning it over to you.
Thanks, Val. Great job. And thank you, everyone, for allowing us to present our programs to you. And if somebody could just let me know when they could see my screen.
We can see it, Leslie.
Okay, great. So as Val had mentioned, ATLAS is an acronym. It stands for Accessing Telehealth through Local Area Stations. And so we're very pleased today to present at your statewide symposium. All right. And I do have an informational video, and I know that sometimes on these formats of calls that it doesn't always play. So I'm going to go ahead and try it, and if we're not able to play through, then we'll make the presentation available to the members, and you can watch it then on your own time.
Leslyann, we lost your audio.
Can you hear me now?
Yes, we can.
Okay. I'm not sure if we'll be able to play the audio from the video. If somebody could just let me know.
No, we can't. But when you click on...
Are you able to hear the sound? Okay. Okay. So we will go with Plan B. We'll make sure that the presentation is available to you so that you're able to watch the video with sound. And this video is part of our co-create and how we began the whole partnership with Philips in developing the Atlas pod. So an introduction to Atlas, an overview. Once again, it's accessing telehealth through local area stations. It is part of VA's Anywhere to Anywhere telehealth initiative, and we're aiming to bridge the digital divide. So what we have done is we've partnered with both public and private organizations to establish comfortable areas for veterans to connect with their VA care team using video telehealth, particularly in communities where veterans live far from a VA facility and or have poor connectivity at home. Scheduling staff will schedule the VA Video Connect appointment and supporting the clinical team to ensure veteran satisfaction with the experience. So our existing partners are Walmart, and we currently have a pilot that spans across 5 locations. And we're working with the veteran service organizations, also with a donation from Philips North America to 5 American Legion sites and 5 VFW locations. So on your screen, you should be seeing a map, and that shows our existing and planned Atlas locations. On the left-hand side, you will see in the key, some of the sites are in green font and some of them are in black font. Those that are in green are open and available for scheduling. And so I'm pleased to announce that we have one that is currently open in Arizona in Wickenburg, and we have a second one that we're working on opening up at the Navajo Health Foundation Sage Memorial Hospital. So you may be wondering how we select our Atlas locations. And so we look at both data and need to make that decision. So we look at broadband connectivity and what it looks like in that catchment area, the number of veterans that currently receive VA healthcare in that area, as well as the number of veterans that are already taking advantage of services. So those that are enrolled in the VA and those that are not currently enrolled in the VA. We also look at the distance and the drive time to the closest VA medical center or outpatient clinic from the proposed location. We look at the market. Are there clinic-based outpatient clinics in the area that are currently being decommissioned? And what does that access look like? How long are the average wait times for that particular area? We also look at such things as if the outpatient clinics are very busy and they don't currently have the capacity to expand their footprint at that location, could we potentially put an Atlas location in and divert the telehealth workload to that site? We also take into account facility and leadership engagement to support the site. Is there enthusiasm amongst the staff? So at the actual site, we look at a number of requirements related to space. So does the site have an existing private enclosed space? And as part of our co-create, we found that a recommended room size of 8 foot by 10 foot really lent itself well, that veterans did not feel claustrophobic in a room of that size. We also make sure that the site is wheelchair accessible and meet ADA requirements with routes that are 36 inches wide. If there are doors or windows present in the area that is to be intended to be used for Atlas, that they either have frosting or they have some type of blinds to provide privacy. We look at lighting, ensuring that it's bright enough to navigate and to conduct a video visit. We do verification that speaking at conversational volume cannot be heard outside of the room. And then we look at to ensure that there's seating available for both the veteran and a caregiver or significant other. And through our pilot, we've learned that bariatric seating at the non-VA site is also a recommendation. We also ensure that there's a telephone available in or near the space that's going to be utilized for the veteran in the event that there is an emergency or there's a technical issue. And then we also want to make sure that all the equipment is secured. So webcams, electrical cords, the computer itself. So we have some technology requirements for Atlas. We look at the internet connection, and we do have a required bandwidth of 1.2 megabytes per second. We need to have a computer with Windows 10 PC, and our VA Video Connect currently runs on the Google Chrome internet browser, so that is what we utilize for Atlas as well. The computer monitor, we recommend a display of 27 inches and a webcam plus a microphone, and those can be integrated with a computer or device, speakers, a keyboard, and mouse. Our PC recommendations, once again, is a Windows 10. We recommend that it's set to automatically update with Windows Defenders installed, and that the PC boots automatically to open up to Chrome and to the Atlas login screen. These are recommendations based on best practices by our Office of Information and Technology to ensure a seamless experience. Other configurations submitted to determine if a solution can be identified. So clinical services at the sites, those will be determined by the local VA that's providing the care there. So we look at services that are most appropriate for telehealth, including services from some of our telemental health hubs and other clinical resource hubs across the country, a demonstrated need for that particular clinical service in that catchment area, the familiarity of the local service lines with telehealth, and then lessons learned from other sites. We do require that there is a minimum of 2 services provided at each location, and that is to prevent the stigma being attached that it's only for mental health or it's only for primary care visits. So we want to make sure that the veteran has the anonymity when they go there, that by the process of deduction, if there was only one clinical service offered, that the non-VA site staff would not be able to figure out what they were coming in for. Some of the clinical services that are currently offered at our Atlas sites across the country are primary care, mental health, clinical pharmacy, nutrition, social work, rehab, and we also have some other additional clinical services that have been added. So at these sites, the Joint Commission does not require accreditation as long as we follow the following conditions. So we're not able to have shared use of peripheral devices, but peripheral devices that have been assigned to the veteran, they may bring with them, such as their blood pressure cuff, glucometer, as long as they take them with them when they leave their room. Care at the Atlas sites is adjunct to their usual VA care so that they have the option to come into an Atlas site or receive in-person care at a VA facility. And we are not able to have VA employees act as a telepresenter at the non-VA location. So scheduling. This is just a quick slide to show you kind of the end-to-end workflow. So the patient is identified and determined to be appropriate for an Atlas site. And so this can be initiated either through a discussion between the care team and the veteran, or the veteran may see publications and ask their care team about it. The appointment is then scheduled in our virtual care manager package, and then the veteran and provider are notified of the appointment information, and both the veteran and the patient receive an email with the specific information. If the veteran does not have an email, that will then be provided to them by the scheduler. And the patient is given a 6-digit code that they will take with them to the non-VA site, and they will utilize that code to connect to their appointment on the date and time of the appointment. And so it's unique to that specific appointment for that date and time. So if they had multiple appointments at that location, they would have multiple different codes to connect. And so the veteran will then go into the private area, enter the code, connect to the application. They'll be placed in the virtual medical room. So in the same fashion that you've seen Val and Jeremy connect, they will, if the provider is already in the room, the connection will start immediately. And if the provider is not there, the veteran will see a virtual medical room screen saying that the provider has not yet joined, and we use that screen to announce updates about clinical notifications that we would like the veteran to know, such as like during flu season that they should get their flu shot. So once the appointment is over, at the non-VA site, we have what we call site attendants, and they clean the space and ensure that it's ready for the next patient. So I wanted to show you some of our current spaces. So this is our Eureka, Montana Atlas site, and this is the pod design. So when you watch the video, you'll see that we had some cardboard constructs of what this would look like, and this is it when it came into fruition. So we've really took a lot of feedback. We took this pod to the VFW and American Legion conventions and received feedback from veterans, and we came back and really worked on a solid design. So the lighting has ambient lighting, which is what Philips utilizes for some of the MRI and CAT scans. We also have lighting above the monitor so that it gives it almost like the vanity lighting, so that the provider can adequately see the patient and their nonverbal expressions. You have the camera at the top of the monitor screen there, and the keyboard and mouse, which are all covered with antimicrobial covers. You can see on the countertop there is a phone there. The scales are part of this picture, but they're not part of the space. They were placed in there during the opening. So the next one is our Atlas site in Springfield, Virginia. And so this site had an existing space that they did not feel the need to have a pod installed. So essentially what the design team at Philips came up with was installing one wall of the pod onto this post existing wall and then placing that ambient lighting into their existing ceiling. Next is Ashboro Walmart. And so this is very similar. They have went with the same chairs as we have went with at the VSO sites. So these chairs you can see are very sturdy, and they offer and afford the veteran the ability to utilize those to sit down and stand up. And they have since put 2 chairs in there and removed the smaller plastic chairs that you see in this picture. So other community partners for organizations beyond those currently supported by the Atlas program team, like other veteran service offices, libraries, assisted living centers. Local VA teams are welcome to pursue those partnerships without permission from the VISN or without permission from the VACO team. We also encourage them to reach out for guidance and resources that we've developed through the pilot, and we're working to publish those for a broader expansion. So for sites that are interested in becoming a National Atlas partner, I've put in here the Secretary Center for Strategic Partnerships, and they collaborate with the industry and nonprofit organizations to cultivate and steward a significant external resources and expertise to further the VA Secretary's highest priority initiatives for veterans, their families, survivors, and caregivers. With delegated authority from the Secretary, our mission is to seek out big, bold, impactful collaborators. I have their contact information there. And then I also have some slides at the end for some additional information on Atlas. So we have some outward-facing websites that you can feel free to check out on your own time. And that's it from me, unless there's any questions.
So we'll turn it back to the moderators to handle the question part of this, if that exists.
Thank you. One thing that I wanted to bring up, we do have a question from Elizabeth. She wanted to know how she can refer a veteran to the program. And before I let you answer that, I wanted to ask Chris, the Zoom tech, if you can let people have the chance to unmute themselves. That way, if they have any questions, they can ask us and we can go about answering those. Or if you don't want to talk, you can also use the chat box and type up your question and we'll answer them as they come. Thank you.
So to answer your question, when a patient wants to sign up for utilizing or receiving iPads, for example, it all starts with a consult that is placed inside the electronic health record. We call it the digital divide consult. That consult is placed into the health record by the clinician who's wanting to see the veteran virtually. and that consult first is received by social workers at the VA who will contact the veteran, assess their needs, assess their situation, do a holistic assessment of their financial issues and other things. Maybe they don't have internet because they can't afford it or whatever. So there's a holistic assessment that takes place, and after the social work does that assessment of connectivity, then telehealth orders the devices, and within a few business days, the veteran receives the devices at no cost, shipped to them via the mail. Leslie, did you want to talk a little bit about how a veteran would enroll, for lack of a better word, to Atlas?
Absolutely. So for Atlas, if a veteran is interested and there's one in their geographic catchment area, they would reach out to their local VA medical center to see if an Atlas appointment would be right for them.
So Elizabeth wrote back and she says she's outside of a VA provider, so she cannot do this. Who can she call? Or who can the veteran call?
I'm not exactly sure if I understand Elizabeth's question. So it's a veteran that doesn't seek care at the VA, or maybe I'm misunderstanding the scenario.
Elizabeth, are you able to unmute yourself? Do you want to just maybe ask the question, that way we're all clear on it? She cannot unmute. 1 second. Chris, can you have? Okay, 1 second. So she says she cannot unmute. She says she is a Tri-West / VA community plan provider.
Leslie, did you have any words of wisdom on that particular aspect of care?
So it sounds to me, Elizabeth, like you are a provider in the community and you want to know how you can let veterans in the community know about VA Video Connect and Atlas. Is that correct?
Yes, she says correct.
Okay. So if you have a veteran who's interested in VA Video Connect and they have connectivity at home, they may be able to utilize their own devices if they have them. If they do not have the devices, then we would need to bring them into the VA, do the digital divide consult, as Val had mentioned, and then get the resources out to them. The other option would be is if they're in a catchment area for Atlas, that particular location could be shared with them and they can reach out to their local VA team. So most of the veterans, if they're interested, if they have a primary care provider, that's the good first starting step. And then we can go from there because the primary care providers can put in the consult to digital divide as well. And Val, I'm not sure if you have anything to add on that.
Yeah, no, that sounds very good and very accurate. Thank you for answering that.
So she asked again, so who do they ask to get the consult? The primary care provider?
Yes. Mm-hmm.
Okay. Does anybody else?
And for Atlas sites, just to add on to that, the veteran does need to be enrolled for VA care to be able to utilize an Atlas site. And I know that in some of the discussions, some people had, thought that it was kind of like they could walk in and receive care at that site. They are pre-scheduled appointments.
Do we have any other questions? Well, if we don't, we can end the session and give everybody a few more minutes of time. Do our presenters have any last words or any last comments they want to make?
Yeah, we just appreciate being able to present to you all, and we thank you for this opportunity. And we're very excited about what we're able to do for our veterans, and it's an honor to be able to be involved with this type of care to those who are the heroes that make our country what it is.
Yeah, definitely appreciate the opportunity to get the information out there.
Yes, I just want to thank you for your time and supporting our veterans. And if you have any, questions following this, please feel free to reach out. We would be happy to answer those for you. Thank you for your time today.
Awesome. Well, have a great day, everybody. Thank you for your time.
Bye now.
Bye.